So good afternoon and welcome to our webinar on moving on from COVID and how should our food system adapt. Barbara Bray has very kindly agreed to guest host this webinar and I'm sure it's going to be absolutely wonderful. So Barbara has 20 years experience working in the agri-food sector in the UK, Europe, the Middle East and African countries. Barbara regularly chairs meetings on nutrition and speaks at events on the subject of food production and nutrition. In 2017, Barbara was awarded a Nuffield Farming Scholarship, and her project on vegetable production for specific nutritional need reviewed biofortification initiatives and food policies in countries including China, South Korea, Australia and New Zealand. Her findings have inspired her to create solutions to encourage different parts of the food chain to collaborate and communicate more effectively with each other. Barbara was awarded an MBE in the 2019 Birthday Honours List for services to food nutrition. And we're very lucky to have her here today. So without further ado, I'm going to pass you over to Barbara and I hope you all enjoy.
Thank you very much, Charlotte, for the introduction, and thank you all for signing in to this webinar. It's great to see so many familiar faces, and I'm really looking forward to the Q&A session at the end. So today, I want to talk to you about my view of how we should focus on the food system going forward after COVID-19. But first, let's take a trip to the past. The past is a foreign country. They do things differently there. I want you to imagine we're in the year 2040, 10 years after the United Nations SDGs, Sustainable Development Goals, should have been achieved. The deadline had to be extended, but it was worth it. Now, there is zero hunger, and our food system is based on sustainable food supply chains. People enjoy food in ways that we could only dream of in 2020, taking time to eat with family and friends and enjoy quality meals and snacks. Type 2 diabetes has been almost eradicated, and the changes in the food environment mean that whole foods, mainly plants, are commonplace in the home and in the community clubs where many people go to eat and relax with neighbours. Now, let me take you back to the 1970s, the decade of my birth, and the time of Primula cheese, baby sham, and instant mash, probably all together. The oil crisis had sparked recession throughout industrialised countries. War was being fought in Vietnam and in the Middle East, and thanks to the Green Revolution, the economies of developing countries started to improve. Food in the UK was available, affordable, and adequate. Over time, the cost of production came down, quantity of affordable food increased, and so did the quantity of calories. So let's take a look at three areas from our past: cheap food, inequality, and climate change. Recently, we had a look at the Marmot report 10 years on, and Professor Marmot reported that people can expect to live more of their lives in poor health. He said that improvements to life expectancy have stalled and declined for the poorest 10% of women. The health gap has grown between the wealthy and deprived areas. And importantly, he said that place matters. Living in a deprived area of the northeast of England is worse for your health compared with living in a similarly deprived area in London, to the extent that life expectancy is nearly 5 years less. Following on the theme of insecurity, when we look at the SOFI report, the state of food security and nutrition in the world, it also highlights that wealth and growing inequality is a problem internationally. And the number of poor people in food insecurity is higher in countries where the gap between the wealthiest and the poorest is growing. The United Nations Sustainable Development Goal 1 is no poverty. Globally, the number of people living in extreme poverty declined from 36% in 1990 to 10% in 2015. But the pace of change is decelerating, and the COVID-19 crisis risks reversing decades of progress in the fight against poverty. New research that was published by the UNU World Institute for the Development of Economics Research warns that the economic fallout from the global pandemic could increase global poverty by as much as 500 million people. And this will be the first time that global poverty has increased in 30 years, since 1990. Let's take a look at cheap food and Brexit and the implications. Earlier this year, the Food Foundation published their Broken Plate report, which shows us that the poorest 10% of UK households would need to spend 74% of their disposable income on food to meet the Eat Well Guide costs. So the Eat Well Guide is on the left of my screen. You can see the range of lovely fruit and vegetables we're all supposed to focus on. So this figure compares to 6% of the richest people, 6% of the income of the richest 10% of people in the country. United Nations Sustainable Development Goal 2 is zero hunger. We know that 820 million people in the world are undernourished, but 2 billion people are overweight or obese, and no region is exempt from the epidemic of overweight and obesity. So finally, in our past, let's take a look at climate change. 5 years ago in Paris, world leaders committed to a historic agreement to tackle climate change, and they agreed to hold the increase in the global average temperature to well below 2 degrees above pre-industrial levels, and to pursue efforts to limit that increase to 1.5 degrees. They also agreed to step up efforts to adapt to the impacts of climate change and make finance flows consistent with a pathway towards low greenhouse emissions and climate resilient development. The UK was set to lead by example with its net zero emissions target by 2050 that was written into law last year. However, the government has not yet set out detailed plans, and the Committee on Climate Change is urging them to use the lockdown recovery period to focus on low carbon work programmes. We know that the FAO are really focusing on agroecology, and I'll mention later about the EU and what they plan to do with their farm to fork strategy. So now let's move to the present. And I, for one, definitely wish that 2020 would close early and let us move forward. In January, on the 30th, the United Nations Agency, World Health Organization, WHO, declared the novel coronavirus, COVID-19 outbreak, a public health emergency of international concern. Within weeks, countries implemented travel bans, social distancing, and finally, lockdown. In March, we entered an unfamiliar period of time, summarized by the term Bukka. It's a concept introduced by the American military after the Cold War, and it means volatile, uncertain, complex, and ambiguous. It presents our leaders with a situation of constant change that needs to be managed with good communication and responsive decision-making. It presents the population with a challenge of moving away from fear and learning how to adapt to a new normal. Over the weeks, we've been bombarded with international scorecards of the virus spread. Well, at least until it showed that we were handling it worse than all the other nations, then we just saw our performance. We had panic buying. Shoppers in the UK made an average of 5 trips to the supermarket in the week following the announcement of the COVID-19 social distancing guidelines. The additional shopping trips may have seemed like a sensible way of taking control of the situation, but this had a range of consequences. It disrupted the supply chain as logistics businesses, supermarkets, manufacturers and farmers rushed to restock. It left vulnerable people such as the elderly, people with diets restricted by allergies, and people on low incomes without sufficient access to food. It led to an increase in domestic food waste. Fruit and vegetable growers who were in the process of securing workers from Eastern Europe found themselves with a labour shortage as borders closed and promised workers did not travel. The Pick for Britain campaign was launched to bring local labour to the fields. And now, here we are in June, looking at the reality of inequality. The latest Food Foundation figures show that 5 million people in households with children are currently facing insecurity, food insecurity. Last month, the Agriculture Bill was passed, or had its third reading in Parliament, and was passed without the new clause amendments that would enable us to have an emergency coronavirus bill, and I'll talk about that later. And we had the easing of lockdown, still social distancing, but with a slight difference. So what does the future hold? I've chosen to break it down into 3 areas: Future 1.0, 2.0 and 3.0. And I'll start with the new normal. 2 words: Google Trends. I'm sure I'm not the only one who likes looking at what other people are looking at on the internet. I pretend that I'm browsing for work, but actually I'm fascinated. In March, the search for the term immunity peaked around the start of lockdown. People searched for the term vitamin C, and searches for the word veg went up and have stayed relatively high. Now, if you're anything like me, you'll have Googled veg box delivery only to find out that you couldn't get a veg box delivery for at least 3 weeks. As we all scrambled to get our hands on fresh fruit and vegetables, sales figures are showing that snacking and alcohol consumption also increased worldwide. The stress of the COVID-19 situation was driving people to find solutions to protect their health, but also to find comfort. Some of these new healthy shopping behaviours may stay if they fit well with people's lifestyles, but there is a danger that old habits will take over as old routines are picked up again now that we're out of lockdown. One thing that will be with us, though, is reduced disposable income for people who've lost their jobs or have been furloughed or have a job still but reduced to 80% of their salary. In my food safety and consultancy business, I spent the first few years helping food businesses on food safety standards, educating staff on auditing and risk assessment, and providing advice on nutrition traffic lights. In the last 2 years since my Nuffield Farming Scholarship, I've noticed more and more food businesses showing an interest in building sustainable nutrition into their food strategy, and I'll talk about that more shortly. On my Nuffield travels in Hong Kong, Shanghai and South Korea, I realised that the healthy choice is the easy choice. The tasty street food of crisp vegetable stir-fry and noodles, the train station lunch of nourishing chicken porridge with fermented vegetables, and the afternoon snacks of sticky bread buns filled with bean curd were a world away from the chocolate, crisps and snacks and sandwiches of the UK's meal deals. We need a culture change, and the food industry needs to be part of the solution. We all saw the disaster that struck when businesses like cafes and fast food restaurants had to close and lock down, and the supply chains weren't able to pivot quickly enough to be able to get food to food banks and vulnerable people. We need to look at how we can change this and make sure that we have an integrated system where we can feed people regardless of whether they have enough money to pay. And the emergency coronavirus plan would have helped with that. Let's take a look at Future 2.0, starting with trade deals. There are foods that we try and ban from sale, exclude from our diet, and obsess about. But healthy and affluent people have a choice in this country. They have a choice because where you live determines the quality of your life. Healthy and affluent people have a choice because they can afford to avoid some of the damage caused by a modern lifestyle. Healthy and affluent people have a choice because they can pay for better quality food if they choose to. But here's the thing, we're not all healthy and affluent people with unlimited choices. We have a diverse population with a whole range of needs. For example, we have a Black and ethnic minority population genetically at higher risk of type 2 diabetes. We have an older adult population at higher risk of malnutrition. And we have a teenage population at higher risk of hidden hunger, despite overweight, despite obesity. All the extra food that they keep eating doesn't give them enough fibre, folate, vitamin A, and iron. COVID-19 has disproportionately affected the Black and ethnic minority population, older adults, and those with comorbidities such as type 2 diabetes and obesity. The trade deals that we make in future will need to ensure that food safety, adequate nutrition, and availability of food for all, regardless of their ethnicity, disposable income, or nutritional requirements for their age group. Timing is everything, and the conditions for leaving the EU at the point of recession really are suboptimal. Let's take a look at protectionism and WTO. Now, the World Trade Organization have given an outlook for trade in 2020 and 2021, and the Director General notes that the COVID-19 crisis has caused dramatic supply and demand shocks in the world economy, and that these shocks are inevitably causing major disruptions to trade. WTO economists project that trade will fall steeply in every region of the world and across all sectors of the economy. In an optimistic scenario, the volumes of global trade in goods volumes could fall by around 13% in 2020. If the pandemic is not brought under control and governments fail to coordinate policy responses, the decline could be up to 32% or even higher. Two factors are going to determine the strength of our recovery. One, how quickly the pandemic is brought under control, and two, the policy choices that governments make. So that means that the emphasis on governments is to work together and facilitate movement of goods, people, and in particular services, because it's those services moving around the world that bring our food to our doorstep. 2 words, sustainable food. The COVID-19 pandemic shone a light on food security and the supply chain worldwide. Sales of vegetable seeds and plants peaked as people rushed to start growing their food. All of a sudden, there was a huge interest in where food comes from, how it was grown, and how healthy it might be. And I wonder if this grow your own phase will last after the lockdown period, or will people then look to trusted sources to provide their food? In my business, I work with fresh produce growers committed to providing sustainable food. And 5 areas we've identified to work on are, firstly, focusing on nutrients that we don't have enough of in our diet. I mentioned folate and fibre. Those things are key, and they're found in abundance in green leafy vegetables and fresh produce in general. And we need to find a way of getting more of those into the food system. It's not just the responsibility of the growers, but the responsibility of food manufacturing and food service sector as well. Second, measuring greenhouse gas emissions. As people look to the sustainability of food, we need to have transparency on what the greenhouse gas emissions are in a food life cycle. We might find that some of the foods we're saying that are grown locally might have a higher greenhouse gas emission than something that's been imported. But the important thing is we need to know. Reduction of food waste. We often ignore what's left in the field that's unharvested because it wasn't sold, but actually that has a value. We know that people who are vulnerable and relying on food banks can't get access to fruit and vegetables because of their low income. But there are now ways and grants to facilitate taking that crop from the field, taking it to the charitable sector and distributing it, so it's not wasted. It wasn't going to be sold anyway. Let's leverage that. Sustainability certification. A lot of businesses are doing a lot of things that are sustainable within their business, but having certification by a third party just qualifies that for the outside world and helps you to understand what you can do better each year. And finally, sustainable sourcing of raw materials. It's all very well to run your business sustainably, but look at the inputs and look at the ingredients. Where are they coming from? And is that a sustainable supply chain? In my opinion, climate change and the fear of lack of food will drive an agenda for sustainable food still further. And finally, Future 3.0. The Food and Drink Federation CEO, Ian Wright, says that if you can't feed a country, you haven't got a country. And he's right. In my opinion, Sustainable Development Goal 2 to end hunger, or zero hunger, needs to be at the centre of future food system plans. SDG 2, end hunger, achieve food security and improve nutrition and promote sustainable agriculture, recognises the interlinkages among supporting sustainable agriculture, empowering small farmers, promoting gender equality, ending rural poverty, ensuring healthy lifestyles, and tackling climate change and other issues addressed within the 17 Sustainable Development Goals set by the United Nations. COVID-19 is putting an additional 130 million people at risk of suffering acute hunger by the end of 2020, according to the World Food Programme. In order to address these risks, the Food and Agriculture Organization urges countries to do the following: meet the immediate food needs of their vulnerable populations, boost social protection programs, keep global food trade going, keep the domestic supply domestic supply chain gears moving, and support smallholder farmers' ability to increase food production. Let's take a look at the food system, and let's take a closer look at policy and how this can help. We recently had the reading of the agricultural bill in England, and as I mentioned, there was a new clause, there was an amendment called the Emergency Coronavirus Plan. We already have something in place to meet emergency or make emergency measures to help us do this. But what I found was that the first 3 weeks of the lockdown period were quite critical. We weren't able to get enough food of the right nutritional quality to people who were vulnerable. Having something more permanent in place will give us a structure that we can react to, a bit like how the emergency organisations like UNICEF and WHO are able to react internationally when there's a crisis on hand. The Coronavirus Emergency Food Plan made provision, amongst other clauses, for the ease of access to nutritious and healthy food across different socioeconomic groups and communities, and that the level of demand for emergency food aid and the adequacy of services were there to meet that demand. Other policies we could take a look at is the one from the EU, the Farm to Fork strategy. It has many things in there which might be controversial, for example, increasing the amount of organic food, the land that's laid down to produce organic food, and a whole list of drivers around pesticide and fertilizer use reduction. but it's still something that we need to be aware of, as that is our biggest market and we will probably be taking a lot of food from them. And finally, the United Nations voluntary guidelines for nutrition pull from some of the areas that I've just talked about with the Food and Agricultural Organization, addressing the immediate food needs of vulnerable populations and the access of nutritious food and healthy food for everyone. Not just having calories in. We're not looking at people getting 2,000 calories a day. It's the quality of those calories that are important. So all this takes us nicely to production. And in the TEDx talk that I did back in February, I used a model of sustainability to demonstrate how we can do this. Firstly, let's look at the definition of sustainability. And here I've used the definition from the Brundtland Report, which defines sustainability as paths of human progress that meet the needs and aspirations of the present generation without compromising the ability of future generations to meet their needs. In my talk, this wooden model that was made up of a panel balanced on 3 legs of equal length to give it stability, demonstrated the 3 pillars of sustainability, which are people, profit, and planet. And I gave each of the 3 legs and made each of those a pillar of one of the principles of sustainability. So let's take a look at some examples. If a business is purely focused on making profit, then it might buy its ingredients cheaply from a country where water is scarce and that there is a risk of drought. This cheap food has a negative impact on the planet. A business might buy ingredients cheaply from a supplier that uses forced child labour to produce the goods. This cheap food has a negative impact on people. When a business produces food that increases the risk of type 2 diabetes for a population group, when they produce food that's nutritionally complete for older adults but can't make a profit, when a business produces food that increases the risk of obesity in young adults, this is not sustainable. We need a culture change, and the food industry needs to be part of the solution. By the food industry leveraging its position, we can bring in primary production and agriculture, we can bring in the health sector, we can bring in the education sector. But it is all about people. WHO produced a report just last week where they talk about some of the issues that we're now experiencing. They say that attempting to save money by neglecting environmental protection, emergency preparedness, health systems, and social safety nets has proven to be a false economy, and the bill is now being paid many times over. The world cannot afford repeated disasters on the scale of COVID-19, whether they are triggered by the next pandemic or from mounting environmental damage and climate change. Going back to normal is not good enough. When you put people at the heart of a development of a system, then integration of different areas is a given. Protecting the environment has a positive effect on our health, and building sustainable food systems and a healthy food system is a part of that. I spoke about initiatives that private companies can take to improve their sustainability, and national and international policies are needed to support positive change. Let's take our strategy. In the UK at the moment, we have the National Food Strategy for England, but we also have 16 government departments that get involved in food policy. Who really has the power there? Is it the Treasury? Is it the Department of Education? Is it the Department of Health and Social Care? Is it DEFRA? Who shouts loudest? And are all these 16 departments really working together for the greater good? Or is it really first come, first served? We need to find a way of using private enterprise to bring in all these different actors so that we can start to make positive changes that will ensure that everybody gets to eat. If we focus on people and planet as well as profit, then perhaps my vision of 2040 with zero hunger and adequate nutrition for all may be achieved. The past is a foreign country. They do things differently there. Thank you for listening. I look forward to your questions.